Hello, I'm Rachel McKenty, Director of Programs and Development at Legacy Education. Thank you for joining me for the CPC CPB Practice Exam Review. In this presentation, we will review 3 CPT and 2 ICD-10 CM CPC CPB exam questions surrounding the integumentary system. Let's start with our CPT questions. Question 1. Joe has a terrible problem with ingrown toenails. He goes to the podiatrist to have a nail permanently removed along with the nail matrix. What CPT code is reported? In the CPT index, look for removal nails, and you are directed to 2 code ranges, 11730 through 11732 and 11750. Documentation states the entire nail and root, also known as the nail matrix, are removed. Code 11730 reports nail removal only. In the numeric section of the CPT, removal of the nail and nail matrix is coded 11750. The answer is 11750. Question 2. What CPT codes would best describe treatment of 9 plantar warts removed and 6 flat warts, all destroyed with cryosurgery during the same office visit? Cryosurgery is a method of destruction using extreme cold to destroy the lesion. In the CPT index, look for destruction warts flat, referring you to CPT codes 17110 and 17111. In the numeric section guidelines under the integumentary section, subheading destruction, flat warts and plantar warts are both included in the definition of lesions. Warts are considered benign lesions. They are coded from code range 17110 through 17111. A total of 15 lesions were destroyed by cryosurgery. Code 17111 represents the destruction of 15 or more lesions. The answer is 17111. Question 3. A 63-year-old patient arrives for skin tag removal. As previously noted at her last visit, she has 3 located on her face, 4 on her shoulder, and 15 on her back. The physician removes all the skin tags with no complication. What CPT code or codes are reported for this encounter? Look in the CPT index for removal skin tags, and you are directed to 11200 and 11201. Based on the documentation, the total number of skin tags removed is 22. Code 11200 is reported for the removal of up to and including 15 lesions. Notice the wording for 11201, which includes each additional 10 lesions or part thereof. The words part thereof in this code description means you do not need to have a complete total of 10 skin tags to report the add-on code. The add-on code can be reported if the additional skin tags removed are 10 and under. It is not necessary to append modifier 52 to this add-on code. As a reminder, modifier 51 is not appended to add-on codes. Report codes 11200 and 11201 for the removal of 22 skin tags. Question 4, and on to ICD-10 CM. A patient presents to the ED physician with multiple burns. After examination, the physician determines the patient has 3rd-degree burns of the anterior and posterior portion of the left leg, starting at the knee, extending above the ankle. He also has 3rd-degree burns of the anterior portion of the left side of his chest. The patient also has 2nd-degree burns on his left upper arm. What ICD-10 codes are reported? In the ICD-10 CM guidelines, 1C19D1 indicates when more than one burn is present to sequence first the code reflecting the highest degree of burn, which would be 3rd degree. So let's find the ICD-10 codes. Starting with the 3rd-degree burns of the anterior and posterior portion of his leg, starting at the knee, extending above the ankle, in the ICD-10 alphabetic index, look for burn, lower limb, multiple sites, except ankle and foot, left, third degree, referring you to T24-392. Third degree burns to the left leg at the knee extending above the ankle, multiple sites, are coded as T24-392. Next is the third degree burn of the anterior portion of the left side of his chest. Third degree burn to the left side of the chest is found in the alphabetic index by looking for burn, chest wall, third degree, referring you to T2131. The next code is a second degree burns to the left upper arm, which is found in the alphabetic index by looking for burn, upper limb above elbow, directing you to see burn above elbow. Look in the alphabetic index for burn above elbow, left, second degree, referring you to T2232. The tabular list indicates all these codes have 7 characters. The 7th character A, initial encounter, is reported for all the burn codes, and the X placeholder is used to keep the A in the 7th position. These are the 3 codes that we just found together. Let's find the rest. Let's review the question one more time to determine our last code. The physician determined the patient has third degree burns of the leg totaling 12.5%, third degree burns of the left side of the chest totaling 4.5%, and second degree burns of his left upper arm totaling 7%. This is a total of 24%. To report the extent or percentage of the total body surface area burned, look in the alphabetic index for burn, extent, 20 to 29%. Category T31 is used to identify the extent of the body surface area involved. The 4th character identifies the total body surface area involved, or the all degrees burned total. The 5th character identifies the percentage of body surface with third degree burns only. The third degree burns total 17%, which is the 12.5 and the 4.5, reporting the 5th character 1. Look in the alphabetic index for burns, extent 20 to 29% with 10 to 19% third degree burns, referring you to T3121. The TBSA codes are only 5 characters long, and you do not need a 7th character extender to complete this code. The correct answer for this question is T24.392A, T21.31XA, T22.232A, and T31.21A. This covers the leg, the chest, the arm, and the extent of the burns. Our final question. A patient presents to the physician to discuss her acne and asks the physician about a suspicious lesion of the left ear. The patient and the physician discuss further treatment of the acne and agree to take a biopsy of the lesion of the ear. Billing was sent prior to receiving the pathology report. What CPTs are reported? The patient is presenting with acne. Additionally, the patient has a suspicious lesion of the ear, which was biopsy. Okay, so in the alphabetic index, look for acne, referring you to L70.9. The ear lesion is noted as suspicious, and a biopsy was taken to determine whether it was benign or malignant. Because this is submitted to the carrier prior to receiving the pathology report, it is necessary to report unspecified for this lesion. In the table of neoplasms, look for neoplasm, neoplastic skin, NOS, ear, unspecified behavior, which would lead you to this column, and the code D49.2. We would, of course, verify both of these in the tabular list. The correct answer is L70.9 and D49.2. Thank you for joining us. For more CPC, CPB practice exam questions, please visit our website at medicalbilco.com.